Okay. So I will try to do it later. And so thank you, Professor Tan, and good morning, everyone. I'm indeed very honored to have the opportunity to give this presentation on behalf of the Center for Interdisciplinary Evidence-Based Practice and Research in this very meaningful research seminar. So today, as what Professor Tan said, I'm going to present a recent three-wave longitudinal data in mainland conducted by our research center, which focus mainly on individual and family resilience. And the scale of this study is much smaller than the one presented by other speakers before, but I hope that it can still serve as the last piece of dessert after we have so many Michelin 5-star main dishes. And then after that, I promise I will try to make it quick so that we can have lunch soon. So so there's no denying that the fact that the COVID-19 has taken a toll on people's physical and mental well-being. So a lot of research has shown us the negative consequence of this large-scale collective adversity on well-being. And we can actually look at the recent meta-analysis of studies conducted in mainland China, and we'll find that the prevalence of mental health symptoms, including depression, anxiety, stress, sleep problems, post-traumatic stress disorders, etc., during the pandemic was increased significantly during that time. And this can be found in frontline medical staff, teachers, social workers, general public of all ages. And of course, we are very interested in knowing who will survive better in this pandemic. And then this is actually one important issue in resilience. And another phenomenon that is very important and interesting is that it can be very overwhelming to keep up with the COVID-19 precautions months after months, and like social distancing, homeschooling, wearing a mask in public area. We are still doing that, and this kind of stuff completely disrupt our sense of control and normalcy. So in the previous year, some researchers also identified pandemic burnout as an important mental health indicator during COVID. It consists of basically three components. So this concept was adopted from the work setting research. So it consists of three components, which are emotional exhaustion caused by COVID-19 related news or measures, feeling cynical, and lack of accomplishment during the pandemic. And the experience of burnout can have negative downstream consequences, such as deregulated eating, lowered job satisfaction, performance, worsened family functioning, etc., etc. So this variable test was used as an indicator of well-being in our study. So in a study, we look at general mental health and pandemic burnout as the key outcome variables. So as many of the speakers have just said, so resilience is our ability basically to cope with individuals and collective adversities. So if this is the case, the pandemic, I think it serves as an examination of resilience for everyone and every systems on the planet Earth. So research in mental health or family health always talk about two types of resilience, usually separately, individual and family resilience. So it is very simple to understand that individual resilience is basically the individual's capacity to bounce back after negative events, while family resilience is the ability of the family as a unit, higher level unit, to resume normal functioning after adversive events. So it consists not only the summation of individual resilience in the family, but also the structural features of the family system. And for a large-scale multi-system shock like COVID, it requires both individual and family to actively mobilize and coordinate all favorable resources and factors to maintain healthy functioning at individual and family level. So from this perspective, we suggested that these two kinds of resilience are closely interlinked with each other, and it is important to understand the joint effect on well-being during a collective crisis like this. So indeed, I would say that there's no lack of evidence of the protective value of individual and family resilience during different adversity, such as economic hardship, relationship problems, illness, travel trauma, war, and pandemic. So, but these studies usually treat these two types of resilience separately. So from the perspective of multi-level resilience, multi-system resilience, it is important to also examine how their joint or interactive effects during large-scale collective crisis. And this is one of the objectives of the present study. So meanwhile, another objective of the present study is to identify the determinants of resilience during pandemic. And I think Professor Jin Yang has also mentioned delayed of gratification as a very important factor for us to cope with crisis. And where does resilience come from? So this is a question that we always ask about. So resilience comes from the availability of individual, family, social, and even financial resources. And more importantly, the ability to create and mobilize these resources during crisis. And the question that we ask is, who is more capable to create and mobilize these kind of resources to cope with large-scale crises like this? And the literature tell us that trait self-control, or the ability to regulate your behaviors, is a determining factor. It helps us to handle negative situations and react optimally to the environment during crisis. So to put it simple, trait self-control is the capacity to regulate our cognition, emotions, and behaviors according to our long-term goals. So it helps us to suppress some goal-inconsistent behaviors and initiate goal-consistent behaviors. And research find that people who have this capacity are usually more effective in regulating their emotions, more successful in obtaining social support from others, more flexible in utilizing different coping strategies according to their situations, and make more reasonable decisions and doing planning. So it can help us to increase the resources that we can use and help us to mobilize the resources more effectively. So all these effects of self-control, behavioral effects of self-control, are related to the successful creation and utilization of resources to cope with a crisis. And this will in turn contribute to individual resilience. For example, if you are better in regulating emotion, it is easier for you to regulate your stress when you need to work from home and do homeschooling for your kids simultaneously. And so it helps you to stay on track. I think this is very important when routines are disrupted, and more ready to bounce back when the crisis is gone. So if you can maintain an optimal social connection, for example, with others, and seek social support when needed, you are also more likely to survive the hardship brought by COVID and bounce back faster after it. So we think that self-control is a very important determining factors. And this idea is supported by recent research, which suggested that trait self-control is a strong predictor of adaptive behaviors, such as less problematic cell phone use and less procrastination during the pandemic. So in our study, we hypothesized that trait self-control is a particularly important determinant of resilience during COVID, because it helps us to stay on track, manage our emotions, seek social support, etc. So finally, I would like to highlight an important hypothesis in this study. Again, is that COVID, I think, is a collective threat, which is multi-system in nature. And it means that it does not only challenge our individual's cognitive and emotional system, but also higher level macro systems, such as our family structure, organization, the community, and the society. For instance, in addition to creating stress to single individuals, COVID also changed the work-life boundaries and may change the dynamics within your family and your work organizations. So if we conceptualize resilience from this multi-system perspective, then resilience at multi-level may interact with each other to influence our ability to cope with this kind of crisis. For example, we need both individual and family resilience to maintain well-being, and the benefits of individual resilience may be more pronounced in a resilient family system. So drawing on the existing literature on COVID, resilience, and self-control, and taking a multi-level perspective to resilience, we formulate a very simple moderate mediation model like this. Overall, we have 3 hypotheses. So first, we hypothesize that individual resilience would mediate the association between trait self-control and well-being indicators, including general health and pandemic burnout over time. And so trait self-control enhance individual resilience, which in turn improves general health and reduce pandemic burnout. And furthermore, from a multi-system perspective, we also hypothesize that the effect of individual resilience on well-being will be moderated by family resilience, such that the benefits of individual resilience will be more pronounced when the person perceived to be in a resilient family. So overall, the previously mentioned mediation effect of individual resilience will also be moderated by family resilience. So this is a very simple model, a preliminary test using our pilot data. So the 3 hypotheses were examined in a 3-wave longitudinal data set recently collected in mainland China via an online research platform called Quidemo. So we have collected 3 waves of data. Time 1 survey was conducted in September 2021, when the number of new infected cases in China basically stabilized. And while time 2 was conducted 5 months later, when there was a sudden surge of new infected cases. And we checked the same group of participants recently in January 2023, 1 month ago, after China announced nationwide loosening of the COVID restrictions, which followed by surge of infected cases. So in the first wave, we start with a sample size of 1,000 something, and at the end, we retained about 50%. So it is very difficult to retain participants in the COVID time. At the end, we retained about 50% and have about 568 participants. So we distribute our survey via Quidemo, as well I said, an online data collection platform. And then we have measured resilience factors at different levels of functioning in our survey. 5 variables are central to the present analysis, which are trait self-control, individual and family resilience, general health, and pandemic burnout. And these variables were measured by well-validated instruments, which showed good psychometric properties in Chinese samples before. So overall, this is the background characteristics of our participants. And most of our participants were employed, highly educated, from high-income family, married, and have at least 1 child. So this is the background of most of them. And all key variables, the instruments showed satisfactory reliabilities, and both age and annual household income negatively associated with poorer general health, suggesting younger and less economically advantageous group tend to have poor mental health in time 3. So therefore, they will enter as covariates in our main analysis. And trait self-control, family resilience, and individual resilience were associated with poor mental health and pandemic burnout. And some overall change of these key variables over the 3 time points. And first of all, we can look at changes. And we observed an increase in trait self-control from baseline to time 3. And this pattern basically is consistent with existing research that dealing with personal or societal hardship can be a training ground for self-control. So these many of the COVID prevention measures require self-control, self-regulation, and the compliance behaviors may serve as some self-control practices over time. And in our data set, we also observe an increase in self-report self-control over time. And meanwhile, we observed no changes in individual resilience over time, but a significant increase in family resilience across the 3 time points. Since the later 2 waves were conducted when there was a sudden surge in infection cases, the significant increase in pandemic burnout and worsening general health was expected. And indeed, we have included other measures of typical physical and mental health in the survey. And all these measures suggested worsening mental and physical health functioning in almost every domain, especially in time 3, which is actually now. We collected the data 1 month ago, and this time point showed a particular, low level of mental health. A quick overview of the results. First, as expected by a simple mediation analysis, we found that time 2 individual resilience mediated the effect of time 1 trait self-control on time 3 general health and pandemic burnout. So trait self-control increased resilience over time, which in turn predicted better adaptation when the situation of COVID was worsened in time 3, and age and income level of the participants were used as covariates in this analysis. And second, we also found a significant interaction effect between time 2 family resilience and time 2 individual resilience on time 3 general health and pandemic burnout. In general, we find that the effect of individual resilience on well-being was stronger when the person perceived having a more resilient family. To further elucidate the interactive pattern, we can look at this graph. The 3 lines represent high, middle, and low level of family resilience. So what we generally find is that although the association between time 2 individual resilience and time 3 general health was significant at all levels of family resilience, the negative association was stronger when family association was higher. So the B coefficient was like negative 0.29 when family resilience was 1 SD below mean, but it was like negative 0.51 when family resilience was 1 SD above mean. So it preliminary support our idea that the benefits of individual resilience or mental health was significantly enhanced when individuals are living in a resilient family. It takes both factors, individual and family level resilience, to maintain well-being during the pandemic. A similar pattern was observed for pandemic burnout. So when family resilience increased, the negative association between individual resilience and pandemic burnout also increased. And then we checked the moderate mediation effect. Basically, to summarize, the moderate mediation effect was significant for both general health and pandemic burnout. It means that the mediation effect becomes stronger when the family resilience also was increased. So I will skip this part and then. So a few slides on the implications of the present findings and some future research agenda. And this is just a preliminary test of a like interactive effect between individual resilience and family resilience during collective adversity. And the present findings find the interactive effects between these two types of resilience in explaining adaptation and well-being during hard time of pandemic in mainland China. And our general idea is that human resilience does not evolve in a vacuum, but is embedded in many ecological systems, just like what many of the previous speakers suggest. And instead of studying individual, family, and institutional resilience separately, I think it is also a time to integrate research in these different systems on both empirical and conceptual levels. And for instance, when we study the resilience development of children or youth, Professor Stack also mentioned, Daniel Shack also mentioned about this kind of like multi-level frameworks. There could be like a lot of levels that we can consider, from individual to family, school, and community. These levels can have like parallel resilience factors. How to integrate them into a cohesive theoretical framework and to design studies that encompass factors in these different levels will be very important questions. And I think Professor Daniel Shack's work have given us a lot of insight on this area. And furthermore, the present study used a three-wave longitudinal data to test a mechanistic account of how, for example, individual predictive factors such as self-controlled predicted well-being outcomes in pandemic via individual and family resilience, as suggested by Marston, a very famous professor in talking about resilience. The next wave of resilience research should focus on examining the spreading influence of risk and protective factors over time through multiple pathways of intervention during collective adversity. So in addition to identifying the protective factors, it is also important to develop dynamic process model that explain the interaction of multiple resilience factors over time. And to this end, I think many of us have mentioned that longer term longitudinal cohort study will be very, very valuable and important. And finally, the last slide, and the multi-system challenges facing like humanity, such as pandemic, wars, technological revolution, ChatGPT, I don't know whether it is a crisis or not, and climate changes, etc., provide a compelling rationale for intervention that targets at multi-level factors. For instance, we showed that it is more effective to enhance both individual resilience and family resilience instead of focusing on either one of them. So it is clear that multi-system resilience and solutions are needed to address these large-scale multi-system adversities. So future intervention studies could also compare like the effectiveness between single system intervention and multi-system intervention to evaluate the efforts of such intervention, and multi-level resilience index may also be needed. So the present finding, I would say that is a only very preliminary attempt to examine human adaptation in collective crisis using the perspective from individual and family resilience. And future research could further connect different levels, such as organizational level, cultural level, to achieve a more comprehensive understanding of multi-level resilience. And our next step, of course, is to apply the multi-level analysis to analyze this set of data first. So this is pretty much the end of my presentation. And